Are you wondering, when can I walk? When can I stand? When can I climb stairs? When can I drive after a knee and hip replacement surgery? Hi, I'm Dr. Vikram Mhaskar, a knee and shoulder surgeon from New Delhi, India, and welcome to yet another video. Here we're going to be talking about the timeline, the time it's going to take you to get back to normal activities after a hip or knee replacement surgery. So these joint replacement surgeries can happen on one limb or both limbs. Mostly for arthritis, 90% cases happen on both limbs together. Okay, so typically, let's talk about both limbs together. The patient stands up the next day after the operation with a walker. I'm talking about law of averages. Some may stand the same day. You may take a few steps at that time. You're staying in the hospital for about 4 to 5 days. By the time you leave the hospital, you're walking independently with a walker, going to the bathroom and sitting on a Western style toilet with a seat raise. However, you're not capable of climbing stairs or walking over slopes. So you're absolutely mobile within your house with a walker, putting full weight on both your legs. You're also bending your knees from day one. You can bend as much as you want. There's no restriction. But typically by the time you leave the hospital, you're bending about 60-70 degrees in the knee. So you can typically sit by the side of your bed with the legs parallel to the bed. After that, physical therapy starts in the hospital and carries on in your house, where they strengthen your thigh muscles and your leg muscles and your hip muscles so that they can compensate for the straight knees or hips that you have now. That continues. The walker usually goes in about 80% people in 3 weeks after your operation. That's when you begin to climb stairs. And when you climb stairs at 3 weeks, you're climbing one step at a time, not tandem, one step at a time. Following which, at about 1 month, you are walking about 500 meters independently without any support. Some people like to use a stick when they go outside, basically for other people knowing that they've had an operation and to keep off. After a month or so, there are no aids that are given. You can typically travel and take a flight after 6 weeks quite comfortably, but I would still advise you to use the wheelchair facility in larger airports. You can drive a car about a month after the operation, but on the safety side, 6 weeks is a good time to do that. At 6 weeks, if your muscles are strong, you can even start tandem walking, which over stairs. That is one leg on a step, then the other leg on a step, then the other leg on a step, and then you go forward. It may take a little longer in people with chronic arthritis because the muscles are weak for a longer period of time and it takes time for you to be able to do this. Apart from that, you will be on some sort of painkiller, classically for about 3 months or so. Initially on a daily basis, 2-3 times a day, 4 times a day. After about 3 weeks or so, maybe twice a day. And gradually after 6 weeks, once or twice on some people SOS, till 3 months about once a day, and then gradually you go off painkillers. Physiotherapy is as important as the operation. So it's very important to do physiotherapy because it conditions your muscles, it helps in movement, etc. The physiotherapist is a tuition teacher, tells you where you're going wrong and corrects you and gets you better at what you're doing. You typically can be independent in a park, etc. in approximately 4 weeks, where you can socialize and do whatever you want. Vis-a-vis stitch removal, classically this happens between 2 and 3 weeks after your surgery. I like to see my patients because that's an opportunity for them to get out of the house and come and see me. However, till stitch removal or till the stitches are more or less healed, I prefer that they don't go out much because I don't want them to pick up infections from outside. I hope you got a lot of information on how your progress happens after a knee or a hip replacement surgery. The same thing when it's a single joint, the time period is half. That's the only difference because the other leg is all right. If you like my channel, please like and subscribe to it and please follow me on Instagram. For those who like Hindi content, we have a successful Hindi channel with a silver play button. Please like, subscribe and follow it. And those who want to get in touch, the number is below, get in touch.